posteriorly, you're going to look at the scapula. So Nick's quite a good case in point because the level of his scapula is mismatched. Yeah? So you want to look at the level of the apex of the scapula. Incidentally, which comes in, apex comes in around T7, T8. Alright? The spine of scapula, and on Nick, obviously, because one's up and one's down, usually comes in around T3, T2, T3. So this side's lower. Alright? You want to look at winging of the scapula, which will indicate either, depends where it is, if it's winging from the lower part of the scapula, it's going to indicate the subscapularis isn't holding the scapula flat, so there's some kind of laxity there, it's not working as well as it should. If it's a total winging coming from the top, so the whole medial border of the scapula is winging up, then it's going to be more an issue of the rhomboids not holding flat. Okay? So for Nick, it's lower, so you're thinking more of it's a subscapularis issue on this side, because up here you can see that the musculature is holding it flat, whereas on this one, more the whole edge of the medial border is lifted. You see that? There's a difference. So, and actually, he's closer in at the bottom. The subscapularis here is holding it in at the bottom, but rhomboids here isn't holding it in at the top. Yeah? You can palpate and feel the difference between the tonicity of the muscles in that point, right? While you're at this point, because obviously the thoracic vertebrae are involved in the shoulder girdle, you also look at what's going on with the thoracic vertebrae. So you just want to take in, and not in a great deal of detail yet, you just want to take in whether or not there is any hyperextension, or is there any sidestepping, is there any scoliosis of the thoracic vertebrae, and that will be usually caused by muscle tightness. You also want to look at tonicity of levator scapula coming up here, because that comes off of the top edge, doesn't it? So you want to look at what might be going on with levator scapula as well, because sometimes that can be over tight and in itself be causing a lift. You want to take on board the height of the shoulders. Now Nick, because Nick is clearly one scapula higher than the other, is that shoulder girdle, so placement of the bones of the shoulder girdle, or is that Nick's posture? Yeah? So two different things. So you want to look at the height of the shoulders as well. So Nick has clearly one up, one down. Okay, he's got one shoulder higher than the other, which means that if you then look down at the lower thoracic, you can see that he kind of shifts over slightly to the left. In here, you see that? There's like a shift over. Look at the musculature. You see? So you're looking at, so if you looked, sacroiliac came up, it shifts over. You see that? It starts to go that way. It's subtle, but it's there. Alright? You also want, so you're looking at the height of the shoulders. Look at the angle, which you're going to be able to look at a bit more when you look at the lateral view. You want to take in, and we look a bit more at the elbows and all that when you come to do the elbow, but you just want to take in the angle and the space between the arms, which is known as your carrying angle. So you want to take that in as well. And just look for any obvious height differences. Okay? So look at the posterior surface of the axilla. So you know, the armpits. You want to look at the line. You want to see if it's level. Okay? Is it the same as one higher than the other? Alright? If you come to your lateral view, so your lateral view is going to give you a little bit of an understanding of what's going on with the shoulders. Are the shoulders, and you would have plainly been saying before, are they pulled in or out? So we're not interested in pulled in or out. We're interested in whether his shoulders are more anterior or posterior, and whether there is a medial or lateral rotation in the GH joint. Okay? So when you generally looked at posture before, you might have looked and thought the shoulders draw inwards. More anterior or posterior, more medially or laterally rotated is what you're looking at now. Okay? You're also going to look at the angle of his head, because that's going to give you an indication as to what kind of excessive curvature is going on in his cervical spine. Yeah? Remember, if there is an excessive curvature one way or the other in the thoracic, it's going to be carried out the opposite in the cervical. You know that the cervical spine is an anterior curve and the thoracic spine is a posterior curve. Yeah? Lordotic, kyphotic. For Nick's flat through his thoracic really. Upper thoracic, no, he's flat, pretty much flat. There isn't really an awful lot of a kyphotic curve. It's quite a flat, almost like a tip, which means that he's hinging from T2. Yeah, he's got a hinge point.
What does that mean? What does that mean? You say hinge?
Hinging, he's hanging from T2s like that. Yeah, so if this is T2, it's hanging off of it. A lot of movement is going to be happening at that point. Okay? It's got very forward head posture. He doesn't have an excessively increased curvature in his cervical, but his chin is very forward, giving you that. So can you see it's that sort of angle? It's not this, it's not an excessive curve like that, it's more of a proper forward angle. Does that make sense? Do you understand what I mean? Yeah. So it's not just his chin forward, it's falling forward, almost like a skier, as opposed to that, it's that. Look at the shoulders, look at the acromioclavicular, and you're looking for, so you'd look at what's going on at the ear. So his ear is forward of his shoulders. You can see that really clearly, I don't need to draw the line. That indicates, that tells you that he's got his head's moving forward more.
And you use the acromion process as the...
Yeah, as your, a little bit as your guide, coming down through the centre of the GH joint. Yeah? And that's the way your plumb falls. His ear falls directly in front of that.
Mm-hmm.
Yeah? But also, if you come down the centre of the GH, which is here, so is his AC, which means that he has an anterior pull coming through the shoulder girdle, but does he have a medial rotation of his GH? That would indicate, that would indicate a medial rotation of his GH, which he hasn't. So you're looking at, are his hands, does his arm look rotated inward? And it doesn't. So he actually isn't medially rotating through the GH. He's literally being drawn forward by the shoulder girdle. Yeah? His acromioclavicular joints are pulled forward, which might indicate to you, if you think about the attachment points for the scapula, It's going to indicate to you what muscles are causing that pulling forward. Yeah, up and over. Does that make sense? If you come then round to the front, you want to look at the level of his clavicle on either side. So, and the level of the acromioclavicular joints on either side. So level of clavicle, level of acromioclavicular. You can see that he's higher on this side than this side. In just looking at the clavicle, you also want to see if it is stepping out. So does it look like it's really protruding? If the clavicle looks like it's high and protruding, that can also be an indication that he's tight through his scalenes, because your scalenes attach onto your first and second rib that will lift the clavicle upwards. Yeah. Look for hypertrophy in the trapezius at the front as well. Okay. And again, you're looking to see if the GH joint looks like it's turning in or turning out. It isn't turning in, but it's like the whole girdle is coming in this way. Do you see what the difference is? Yeah? Okay. He is higher on this side, most definitely. Look at your... Oh, what that is.
Rubrium.
Subscapular notch. So have a look here. Look at the sternum altogether. Look at the level of the sternum. Have a look down at the xiphoid process. Again, you're looking at the levels. Nick, although you're straight across here, you are slightly up and in. Look at what's going on here, because that's an indication of what's going on in the vertebrae, because of the ribs. Don't forget the attachment point in the ribs. Nick folds in here, so he sort of drops in, doesn't he? Lengthened through his abdominals, so core musculature is lengthened as well. Alright? Take into account anterior part of the axilla. So again, you're looking at the heights here, just to see if one is higher than the other or over or off. Now if you notice at the back, it didn't look like there was a height difference, did it? Posteriorly. Anteriorly, looks like there's a height difference. Can you see that? Yeah? So you want to draw your line across and use that as a kind of a guide. He is up and forward on this side. So you'd expect to see that there was a, but at the back it's not. So it isn't a structural thing as such, it's down to muscular. So it's a functional change, yeah? And also then take into account the carry ankles, all right?